Okay, guys. Hope you got a good start to your week yesterday. Uh, Yesterday we talked about the anatomy of the spinal cord. Today we're going to be looking at the anatomy of the spinal nerves, and we're also going to look at some of these specific spinal nerves and the nerves that they give rise to that innervate and the different parts of the body that they innervate. We're not going to spend a lot of time on a lot of the spinal nerves, but there will be some specific ones we'll point out, and then when it comes to other major nerves in your body, there'll be a few specific ones there that we'll point out as well. So when we look at the organization of a spinal nerve, we're going to see that it's very similar to the organization of a skeletal muscle. Remember that muscle tissue and nerve tissue are two very specialized kinds of tissues in our body. Muscle tissue is specialized for contraction. Nerve tissue is specialized for conducting electrical impulses or action potentials. And we see that the organization of the nerve should remind you of the organization of skeletal muscle. So if you will remember that a nerve is a bundle of axons outside of the brain and spinal cord. Those axons are surrounded by Schwann cells, which are a type of glial cell in the peripheral nervous system that creates the myelin sheath around the axon. So we are specifically here looking more at probably myelinated neurons. But again, remember, even those unmyelinated neurons are going to be lying in folds of the Schwann cells. And so they are going to have a little bit of myelin around them as well. There are layers of connective tissue holding this bundle of axons together, just like we have layers of connective tissue that hold the muscle fibers together in a muscle. If you remember, in the muscle, we had the endomysium, the paramysium, and the epimysium. Well, we have the same thing here, except it's called the endoneurium, paraneurium, and epineurium. So again, very similar as far as naming and what it's doing. Again, just like the endomysium, the endoneurium is the innermost layer of connective tissue in the nerve. It is going to be a very delicate tissue that is around the individual axons and the Schwann cells that are creating that myelin. The paraneurium then is going to be around the fascicles. So just like in muscles we have bundles of muscle cells called fascicles. Well, in a nerve we have bundles of axons forming fascicles, and it's the paraneurium that is like the tape, the layer of connective tissue, the plastic wrap around bundles of axons creating a fascicle. So again here we can see the individual axons. This stuff around them in here would be the endoneurium, so it wraps around individual axons. The paraneurium then is this blue layer. It is the plastic wrap that's wrapping, or not really plastic wrap, but you know what I mean, layer of connective tissue surrounding a group or bundle of axons forming a fascicle. And then the epineurium is this orange layer here. And again, just like the epimysium surrounds the whole muscle, creating the tendon, bundling all those fascicles together, well, the epineurium surrounds the entire nerve, bundling all those fascicles together into the actual nerve. Okay, remember there are 31 pairs of spinal nerves. The first pair exit between the skull and the atlas. Remember, the atlas forms a little platform that the occipital condyles of the skull rest on, and form that pivot joint there between your skull and your vertebral column. And so the very first pair of spinal nerves actually exit there between the skull and that atlas, which again, that axis is the first cervical vertebra. So what we're going to see here, just as we can see there, is that the spinal nerves exit above the vertebra for which they are named. So, for example, the C1 spinal nerves exit above the C1 vertebra, which is the atlas. The other four pair of nerves, notice that uh, there are 8 pair of cervical nerves, 4 pair exit sacral foramina, and then the rest of them, so this is 5. The other 3 pair are going to exit intervertebral foramina, and I'm not going to ask you about that. Again, you can see the divisions here. There are 8 pair of cervical spinal nerves. There are 12 pair of thoracic spinal nerves. There are 5 pair of lumbar spinal nerves, 5 pair of sacral spinal nerves, and then 1 pair of coccygeal. Again, remember when we talked about the vertebral column, 7, 12, 5, 5, 4. Okay, so these numbers correspond closely, but not exactly. Rather than having 7, 12, 5, 5, 4, we have 8, 12, 5, 5, 1. Okay, remember that vertebral column starts at the foramen magnum and ends there in the sacral area of the vertebral column. And so remember, our spinal cord does not go all the way down to the end of our spinal column, and so therefore we don't have as many coccygeal nerves. We just have one coccygeal nerve. These spinal nerves are designated by a letter and a number. Again, the letter indicates the region, and then the number indicates the vertebra that is going to be inferior to that spinal nerve. So again, the spinal nerves exit above the vertebra. So for example, the first pair exits above the atlas, the C1 vertebra. The 8th pair exit above the C8 vertebra in your vertebral column. And then you see some other designations here. We have a cervical plexus, a brachial plexus, a lumbosacral plexus, and a coccygeal plexus. Notice there is no thoracic plexus. We'll talk a little bit more about these plexuses here in a little bit. We are going to focus on that brachial plexus. I'm going to ask you to be able to label the brachial plexus. We'll talk a little bit about these other plexuses, but we won't go into a lot of detail with them. I mean, we'll look at them, but I'm not going to ask you to really know them. Again, notice that since the cervical spinal nerves are C1 through C8, we also have a coccygeal. Well, we can't call that C as well, so we just call it the CO. And we don't really even call it CO1 because there's only one pair of coccygeal spinal nerves. And so, therefore, they're just designated the CO spinal nerves for coccygeal nerves. But all the others, there is more than one pair, so we do designate them with the letter and then the number. Okay, again, so this just shows you again, here's your 8 pair of cervical, 12 pair of thoracic, 5 lumbar, 5 sacral, and then 1 coccygeal, really. Okay, we also have what we call a dermatomal map. Basically, this dermatomal map shows us the innervation of the skin, the cutaneous innervation. So we do have, not only are these spinal nerves branching out and innervating our skeletal muscles and causing our skeletal muscles to contract, but they are also innervating our skin and other tissues. So you can see here that our cervical nerves are innervating our head and neck and maybe the superior portion of our shoulders here. And then, of course, you can see here what we would call the posterior portions of our arms. Again, remember, in anatomical position, this is posterior. So the posterior portions of your arms when you're in anatomical position, of course. Then our thoracic nerves are innervating our chest, abdomen, and back, and also the anterior portion. Again, if you were in anatomical position, this palm would be facing forward, so this would be considered the anterior portion of the arm, and this would be considered the posterior. So the cervical nerves are innervating the posterior portion of the arm, yes, and then the thoracic nerves are innervating the anterior portion of the arm. Again, if you're in an anatomical position, this is anterior. The lumbar nerves are innervating our, I guess you could say, your waist, as well as the anterior portion of your lower limbs. The sacral nerves are innervating your pubic area as well as your the posterior portion of your lower limbs. And then that coccygeal nerve down there at the very bottom is innervating the skin over your coccyx. So the coccygeal nerve isn't really innervating a lot as far as cutaneous, as far as the skin goes. And we'll look more at that here in just a few minutes. Okay, when we look at these nerves, they branch. These spinal nerves branch into rami. A ramus is a major branch of a spinal nerve. Okay, so a ramus is a branch. And plural is rami. So we have the dorsal ramus and a ventral ramus. The dorsal rami are going to be innervating deep muscles of the trunk of your body, allowing you to move your vertebral column, move the trunk of your body, and also the connective tissue and skin near the midline of the back. So the dorsal rami are going to be more about innervating deep muscles of the trunk as well as connective tissue and skin. The ventral rami are variable. It depends upon which part of the spinal cord, which spinal nerves you're considering as to what is being innervated. In your thoracic region, again, we do not have a thoracic plexus, okay? In our thoracic region, our ventral rami of those thoracic spinal nerves are forming the intercostal nerves that are going to be innervating your intercostal muscles and your skin there over your chest and abdomen, mainly your chest. Remember, the intercostal muscles are the muscles that are in between your ribs, okay? So the ventral rami of those thoracic spinal nerves are going to be forming intercostal nerves that innervate the intercostal muscles as well as the skin there in your thoracic region. The rest of the ventral rami of the different spinal nerves are going to form plexuses, and there are 5 plexuses. Again, we've already kind of looked at these. The cervical plexus, the brachial plexus is the one that we're really going to focus on, the lumbar plexus, the sacral plexus, and the coccygeal plexus. So again, the cervical plexus only includes cervical nerves C1 through C4. The brachial plexus includes C5 through T1. The lumbar plexus is L1 to L4, the sacral plexus L4 to S4, and then the coccygeal plexus is formed by the ventral rami of S5 spinal nerve. And then we also have communicating rami. So in addition to dorsal rami that are going to be innervating our deep muscles in our trunk, and our ventral rami that are going to be innervating different things along the length of our body, we also have communicating rami. Communicating rami connect to the sympathetic chain. So if we look at this picture, we can see here are our ventral rami. Again, if this was in the this is in the thoracic area, so it's going to intercostal nerves. Here are our dorsal rami. Again, those are going to be innervating deep muscles of the trunk. Again, a major branch. These are our ventral rami. And again, in the thoracic area, these ventral rami are innervating intercostal nerves. But in other areas of our body, they will be innervating other things. And then here we have our communicating rami. The communicating rami branch and connect to the ganglion, the sympathetic chain ganglion, which we'll talk more about when we talk about the sympathetic and parasympathetic nervous systems. But just remember that those communicating rami are branches off the spinal nerves that are connecting to those sympathetic chain ganglia. Again, here's our spinal cord. You see the gray matter with the butterfly. Here's our little rootlets. This is our ventral root, and this is our dorsal root with the dorsal root ganglion. If you remember, we looked at that yesterday. And then these come together to connect this to make the actual spinal nerve, and that's what we're talking about now are the spinal nerves. So again, these spinal nerves are mixed nerves, meaning they have both sensory and motor fibers. Remember that the dorsal is more about sensory. The dorsal root is more about sensory, and the ventral root is about motor. And I think that's correct. Let me go back. I don't want to be telling you guys something wrong. So I just want to go back and let's review over that and make sure. Right, there we go. The dorsal is sensory and the ventral is motor. So dorsal is sensory and then the ventral is motor. And so, again, that's what we looked at yesterday was the the anatomy of the spinal cord itself and those rootlets and roots coming off of the spinal cord. And now here we have our spinal nerves. So that's what we're looking at today are these spinal nerves, these 31 spinal nerves. Again, they are considered mixed because they contain both sensory and motor fibers. Again, so today we're just going back and looking yesterday we looked at this part up to here, and now we're looking at spinal nerves. So here's our spinal nerve, surrounded by epineurium, containing fascicles, surrounded by perineurium, containing axon, surrounded by endoneurium. We're also talking about rami, dorsal rami, our major branches off of the spinal nerve that are going to be innervating deep muscles of the trunk. Ventral rami innervate different things depending upon which part of which spinal nerves we're talking about. This picture is showing us thoracic spinal nerves, and so these ventral rami are innervating the intercostal nerves between our ribs. But if we were talking about the C1 through C4 or other spinal nerves, then they would be forming plexuses. Again, we don't have a thoracic plexus, but we do have a cervical plexus, and we have a lumbar plexus, and we have a sacral plexus, and we have a coccygeal plexus. We have a brachial plexus. So, but this, we don't have a plexus with the thoracic nerves. And then we see the communicating rami here. Again, a major branch off of a spinal nerve that is connecting to the sympathetic chain ganglia, and we'll talk more about those later. Okay, so now we're going to start looking at these specific plexuses as well as some of these specific nerves. Now, the only specific plexus I'm going to ask you to know is the brachial plexus, and we'll look at it in a minute. So the cervical plexus, again, is made up of spinal nerves C1 to C4, and the major thing I want you to know about the cervical plexus is the phrenic nerve. The phrenic nerve includes nerves from both the cervical and brachial plexuses. It goes from C3 to C5, and it innervates the diaphragm. So the phrenic nerve is how you send signals to your diaphragm for breathing, guys. Your diaphragm is the major muscle that you use for breathing. And so it's the phrenic nerve that includes spinal nerves C3 through C5. That's a tongue twister. So C3, C4, C5 form the phrenic nerve. So again, C3 and C4 are in the cervical plexus. C5 is in the brachial plexus. So those three spinal nerves together form the phrenic nerve, and it innervates the diaphragm, it's helping you breathe. So this is something to help you remember that, a little mnemonic. Again, mnemonics are going to be your best friend in anatomy. We've used maybe a few up to now, like she looks too pretty, try to catch her, tiger cub needs milk. We've used a few mnemonics up to now, but from here on out, we're going to be using several mnemonics. We're using some with the cervical plex, or with the spinal nerves. We'll definitely be using some with those cranial nerves. You remember that from last year. So mnemonics will be your best friend. So C3, 4, and 5 keep the diaphragm alive. Okay, that is how you can remember the phrenic nerve. The phrenic nerve includes spinal nerves C3, C4, C5, and it innervates the diaphragm, which helps you breathe. Okay, the brachial plexus is going to be the other one that I'm going to ask you to know. There are 5 nerves that make up the brachial plexus. That's the axillary, radial, musculocutaneous, ulnar, and median. And this is your brachial plexus. Again, it has different cords. What we're going to do is we need to remember the different divisions of the brachial plexus, the roots, the trunks, divisions, cords, and branches. To remember that, it's regular tanning does cause burns. Roots, trunks, divisions, cords, branches. Regular tanning does cause burns. Okay, so when we get down to what we're looking at here, we're going to look at the cords and the branches, which are the nerves off of those cords. So the posterior cord gives rise to the axillary nerve and the radial nerve. So here is our posterior cord, and it's giving rise to the first two. If we're looking superior to inferior, it's giving rise to the first two nerves from that brachial plexus, the axillary and the radial. And then the next cord is the lateral cord. The lateral cord is this one, and it is giving rise to the musculocutaneous nerve. But then we see that we have a branch off of the lateral cord as well as a branch off of the medial cord coming together to form this median nerve. Okay? And then we have the medial cord alone giving rise to this ulnar nerve. So you need to pay attention to that. And what they told us when I went to Alabama and we were dissecting the cadavers, they told us to look for the M. Okay? The center nerve of that M is the median nerve. So guys, you have to look for the M. If you don't look for the M in any of the diagrams that you look at, look for the M. Okay, because you're going to see that all the diagrams that you look at are not going to necessarily look like this. When we were dissecting bodies, we could look at different brachial plexuses of different bodies, and they didn't look identical. But if you looked for the M, you could identify the nerves, okay? When you are looking for the M, the superior nerve is the musculocutaneous, the middle thicker one is the median, and then the lower, the inferior one is the ulnar. So it's musculocutaneous, median, ulnar in that M from superior to inferior. And then the other two, superior to inferior, are axillary and radial. So and I remember MMU. I look for the M and then I remember MMU. Musculocutaneous, median, ulnar. Okay? And then I know the other two are axillary and radial. Okay? And then if you can come up with a mnemonic, ARMMU, but again, it won't always be like that in every diagram. It won't always be ARMMU. You can't remember it like that. Again, I remember the M is MMU, musculocutaneous, median, ulnar. The median is always the middle of the M. It's the thick part here in the middle of the M. So median in the middle of the M. And the M is MMU. If you find the M, it's always MMU. And then you remember the other two are axillary and radial. And we will look at some other diagrams. I have it more blown up here again. And these different colors, guys, are also showing you the trunks, the divisions, the roots. They're showing you, the red are the roots. Okay, those are the roots. Again, this is the brachial plexus. These are the ventral roots of these spinal nerves forming these plexuses. And then you have your trunks are in blue. Your divisions are in purple and green. And then your cords are in orange. And then your major branches are in yellow. Again, and that goes back to the regular tanning does cause burns. Roots, trunks, divisions, cords, and branches. And again, the branches are what we're learning here, these 5 branches off of that brachial plexus. And again, I have magnified it for you here. Again, there's your M, MMU, musculocutaneous, median, ulnar, and then the other two are axillary and radial. But if we just look up the brachial plexus on Google and look up some diagrams, they won't all be the same. Okay. So I'm going to try to look up another one here. Let's look at this one. Yes. Okay. Do you see the M? Do you see how the axillary and the radial are over here, but find your M? There is your M. Okay. And when you look at there is your M, musculocutaneous, median, ulnar. Okay. So if you find your M, then you know what you're looking at. And then the other two, axillary, radial. And this is probably from the opposite side of the body than the one we were looking at previously. And so that's why superior to inferior is going the other direction. And again, you have to look at which view are you looking at and which side of the body. So, but in any case, it doesn't matter. If you find your M, you're going to be able to find it. Okay, so here's my M. There it is. Okay. And then here's our other two all the way up here, but here's our M. So always look for that M. And you know that's musculocutaneous, median, and ulnar. And the median is always going to be the bigger of the ones. Because my students had a lot of trouble. I think every time I asked them to label this brachial plexus last semester, they missed something. Every time. I asked them to label it 2 or 3 different times, and they missed something every time. So I'm trying to help you with that. Okay, so now looking individually, I'm not going to ask you a lot about individually what these are doing, but I am pointing out here the sensory, the cutaneous innervation, so that you can see kind of what part of the skin and connective tissues are these nerves innervating. Again, these nerves innervate muscles. So what they're giving here is not the muscle that it's innervating, but the action that it's causing when it sends those action potentials. Again, and it would be different muscles that would be doing this. So I guess that's the reason why they don't list all the muscles. They just list the actions of the muscles in that area that are being caused by this nerve. But what we're going to mainly look at is going to be the cutaneous innervation, which is the sensory, the skin and tissues innervation. So again, the axillary nerve is mainly innervating the lateral part of your shoulder. The radial nerve is mainly innervating the posterior of your arm and forearm, as well as the back, the lateral 2/3 of your hand. So they're around your thumb and your pointer and middle finger. The musculocutaneous nerve is innervating the lateral surface of your forearm, as you can see here. The ulnar nerve, as you can see, is innervating. You guys, when you think ulna, you should be thinking pinky. So anything to do with pinky, it's innervating the medial portion of your hand here. Your about half of your ring finger and then your pinky finger. That's your ulnar nerve. So ulnar is going to be mainly the medial two fingers, the pinky and the ring finger. And then the median nerve is innervating the other three fingers, the thumb, the pointer, and then the middle finger, and then the other part of the ring finger. So again, you can tell by, if you've had your ulnar nerve damage versus the median nerve. If the ulnar nerve is damaged, you're going to have tingling and numbness in the pinky and the ring finger. If the median nerve is damaged or being pressed upon, it's going to affect the thumb and the pointer and the middle finger. You guys, we talked about the carpal tunnel. Remember that some of those bones of the wrist form that carpal tunnel. We talked about that. We looked at that. Well, in addition to tendons that connect the muscles of the hand to the muscles in the arm, okay, those tendons run through that carpal tunnel. Your median nerve and your ulnar nerve also run through that carpal tunnel. And so when you have inflammation due to overuse of those muscles in your hand, inflammation of those tendons, they swell and they press on those nerves. And that is what and so if you have numbness in the thumb and pointer and the middle finger, then that tells the doctor that, hey, your median nerve is being pressed on. It's got pressure on it. Whereas if you have some kind of damage or pressing or pressure on that ulnar nerve, it's going to be the pinky and the ring finger that are going to be and I'm not sure that ulnar nerve even goes through that carpal tunnel. Let me look and see if I see it here. I think it might. I'm not sure. But now I know the median nerve goes directly through that carpal tunnel. You can see it there going through that carpal tunnel. No, it's not showing the ulnar nerve going through the carpal tunnel. But now the median nerve goes right through that carpal tunnel. And so a lot of times if someone has carpal tunnel syndrome, that's what they'll see. They'll see that their thumb, their pointer, and their middle finger will be numb and tingling all the time, okay? And again, that is from inflammation of those tendons where this hand is being used for the same repetitive movement. And those tendons can inflame it and press against and push on that median nerve and cause that numbness and tingling, especially in those three fingers, as we can see here. And what they're going to do, we have this white connective tissue here called the flexor retinaculum. Okay, that's going to be basically going over the anterior portion of your wrist. Okay, kind of enclosing that carpal tunnel. So what they do when they do surgery is the doctor goes in there and he just cuts. He cuts that white connective tissue, that flexor retinaculum. He just cuts it. And when he cuts it, that gives more space there in that carpal tunnel. It relieves the pressure off that median nerve, and the numbness and tingling go away, and you can use your fingers better. Again, it's the pressure on that median nerve that's causing the issues with carpal tunnel syndrome. Moving on. Other nerves of the brachial plexus, we're not going to go into those, but again, you do have other nerves that branch off the brachial plexus that innervate the medial arm and the forearm. So again, we mainly looked here at how we're getting our hand innervated, as well as our lateral portions of our forearm and our upper arm, but we really didn't talk about the middle, and so it's some of these other nerves of the brachial plexus that are going to be innervating the medial arm and forearm. And we're not going to go into those. Okay, the lumbar and sacral plexuses are normally considered together because they have a very close relationship. Again, the lumbar plexus includes spinal nerves L1 through L4, so that's going to be these here. And then the sacral plexus includes spinal nerves, or I should say the ventral rami of spinal nerves L4 through S4. So again, that's going to be all around these three here. There are 4 major nerves that branch off of the lumbar and sacral plexus: the obturator, the femoral, the tibial, and then the peroneal. And again, you can see those labeled here. Now, I'm not going to ask you to know and label the lumbar and sacral plexuses, but if you were to go on to medical school or something, then yes, you would definitely, I mean, maybe even college anatomy, they might ask you to label those. Okay, the obturator nerve is going to be innervating the medial side of your thigh. The femoral nerve is going to be innervating the basically front and side of the thigh, the anterior and lateral thigh, as well as the medial leg and foot. So it kind of starts here. Here's anterior and medial, and then medial part of the lower leg there. And then we have 2 nerves that come together to form the sciatic nerve, the tibial and the common fibular nerves together. Just kind of like that median nerve is made up of branches from those 2 different cords, the lateral and, what was the other one, the medial cord. 2 nerves, the tibial and common fibular, come together to form the sciatic nerve. If you've ever heard of anybody talking about sciatica, okay, well, this is what they're talking about. That sciatic nerve is probably being pinched or compressed. Okay, the tibial nerve is going to be innervating, again, the lateral side of the foot, and then the superior portion of the foot. The common fibular or peroneal nerve is innervating the lateral portion of the knee here, as well as the superior portion of the foot. The deep fibular or peroneal nerve is innervating, again, the lateral portion of the lower leg, as well as the big toe and the middle toe, the second toe. The superficial fibular or peroneal nerve is innervating the anterior portion of the leg and the back of the foot. And then the plantar nerve, which makes sense, is innervating the sole of the foot. Again, in addition to some of the anterior portion of the leg. And you can see here that some of these nerves are kind of overlapping is what they are innervating. And then you have your sural nerve that is not shown here, but it is innervating the lateral and posterior 1/3 of the leg, as well as the lateral side of the foot, as you can see here. You have other lumbosacral plexus nerves that are going to be innervating things like the pubic area, the external genitalia, and then the medial and posterior thigh. And then your coccygeal plexus is made up of the S5, the ventral rami of the S5 spinal nerve, and it is innervating muscles of the pelvic floor, which is very important for you ladies, because when you have a baby, it's very important for those muscles of your pelvic floor to be very strong. It makes it easier to give birth. And you can do those Kegel exercises, and you'll learn more about those later. But also, you guys, it's not just good for carrying and having a child, but those Kegel exercises help keep the muscles in the floor of the pelvis strong, so that when you get older, you don't have incontinence. So that when you get older, you can still hold your urine and you don't have to wear Depends or something to keep from peeing on yourself. Because, again, birth can be hard on your muscles in your pelvic area. And so the more you do those Kegel exercises, and if you don't know what those are, you can look it up and learn more about them. They're important right now. You may not think about it, but the more you exercise those, the stronger they'll be as you get older, and that will help you to actually hold your urine better so that you won't be peeing on yourself every time you cough or sneeze, and be able to hold your urine when you get older and not suffer from incontinence and have to wear Depends and things like that. And so remember, I'm telling you this, and when you get to be 50 or 60, I'll be dead, probably. But you remember this and do those Kegel exercises to help prevent incontinence when you get older, and it's a much, much more of a problem for females. Also, that coccygeal nerve, in addition to innervating the muscles of the pelvic floor, also helps to innervate the skin over the coccyx. And we already looked at that earlier in that dermatomal map. You had that one little bitty dot of red. And again, so all this that we've talked about here, you can go back and look at that dermatomal map that I showed you earlier, okay? The cervical plexus and what it's innervating, the cervical nerves and what they're innervating, the thoracic nerves and what they're innervating, the sacral, the lumbar and sacral nerves and what they're innervating, as well as there's that coccygeal nerve innervating the skin right there over the coccyx or tailbone. So we just kind of broke it down a little bit more here and looked at the nerves and which part of each of those areas is being innervated by which specific nerve. Okay, so this is a summary of all the plexuses. Again, you need to be familiar with that phrenic nerve, the cervical plexus C1 through C4, and that phrenic nerve C3, C4, C5 keeps the diaphragm alive. The brachial plexus, you need to be familiar, C5 through T1, you need to be familiar with that, the M and the radial nerve, the axillary nerve, the musculocutaneous, the median, the ulnar nerve, the lumbar and sacral or lumbosacral plexus. Again, there, the main one we talked about was the sciatic nerve, which is the tibial and the common fibular nerve together. And then the coccygeal plexus is S5. And that will be it for today, guys. Don't forget to do your exit slip when you're done here. And also, there will be a quiz over Chapter 12 tomorrow. Hope you have a great day. We'll talk to you later. Bye-bye.